Good morning. Politically incorrect old white guy here. The old white guy part is obvious. Will be 69, will be 70 this year. The politically incorrect part is a long story, but old and white these days, by definition, are a good start along that road. Um, I am a hunter, a gun owner, a firearms dealer. Shall I continue? I think that's enough. All right. Today's topic is the C word. This word is the scariest word in the English language, in my opinion, and it stands for chemotherapy. Yeah, I've been there and done that. About 6 years ago, I had an unfortunate bout with cancer, and without going into the details, underwent chemotherapy, which entailed about 6 months of infusions of this toxic, I believe it's platinum-based chemical, and it's basically a poison that poisons your body and kills cells with preference for recently born cells or cells that are growing, dividing. That's why your hair falls out, and that's why you get neuropathy, which means you lose sensation in the tips of your fingers and your toes and your feet, the periphery of your nervous system. And that's permanent damage. It wasn't too bad in my case, but nevertheless, you do lose some sensation. The good news is it's been 6 years, and the medical profession, to the extent that they can, have declared that episode over, for which I'm grateful. But why do I bring this up? This is personal, obviously, because in my last video, I alluded to Medicare and the need for a plan B to deal with healthcare expenses, and specifically with Medicare, which, is, we all know, is going bankrupt. The reason it's going bankrupt is there are a heck of a lot more old people these days, and old people, as is evident in my case, are more likely to require expensive medical treatment. Talking of expense, I learned something during that experience which I want to share with you, which is pertinent. The very first thing I did is I went to see my GP because I was not passing gas, not being able to go to the bathroom, and I had a sensation of a brick in my abdomen of weight. And she sent me off to get a CT scan, which, by the way, is useless in this case, because they didn't diagnose the problem, even though about a month later we ascertained that my bowel was totally obstructed by the tumor. I had stage 3, which is about a 50-50 chance of survival. But I digress. The interesting, or the pertinent point is that I received a bill from the hospital for, I believe it was $8,000 for the CT scan. And doing some research, I discovered something quite surprising. Medicaid pays about $200 for the same procedure. Medicare pays, I think, $800 or $1,000. It's been a while since I researched these numbers, so don't quote me exactly, but that's order of magnitude correct. Blue Cross Blue Shield and other big insurers pay about 2,000, and then suckers like me end up having to pay 8,000. Why is that? Well, all of the aforementioned have a contract with the medical provider, with the healthcare provider, which specifies that that's what they will pay. In the case of the government, they just basically dictate, this is what we're paying. And in the case of Blue Cross Blue Shield, I believe it's a negotiation. The hospital, that's an expensive piece of equipment and requires skilled personnel to operate and to read and interpret the results, even though in my case, they misinterpreted the results. The hospital loses money on Medicaid. They lose money on Medicare. They maybe break about even on Blue Cross Blue Shield. And so what they try to do is they try to make all their money off people like me who are not, or at that time, were not covered by one of the aforementioned plans. Now that's particularly cruel because if you're not covered by one of those plans, the chances are you are not employed by a major corporation, so you don't have the insurance coverage and the contract to protect you from this billing practice. And they basically just try to, and you have no option at this point. The doctor says, go get the scan, and you're in a situation where you can't shop around. You just go get it. And then you get the bill later. In some cases, they don't even tell you up front how much it's going to cost. Or if they do tell you how much it's going to cost, they'll put a big disclaimer on it saying, well, we don't know exactly how much it's going to cost us. We don't know what we will find in the course of this procedure, and that may throw everything for a loop. So therein lies the conundrum, or therein lies the problem. This is how you can see how you can very quickly and easily go bankrupt if you are one of the unfortunate people who's not covered by insurance. I lie, actually, because at the time I was covered by an insurance of sorts. I was a member of a faith-based medical cost sharing plan, and these are schemes which are exempt from Obamacare. They do not require that they're not required to cover all of the conditions that Obamacare insurers are required to cover. And because it's faith-based, there's certain conditions which they don't cover, for example, abortions. So they save some money by offering limited coverage and offering coverage to people who, by and large, are clean living, honest people who are not going to contract, some illness due to dirty intravenous needles or other unhealthy lifestyles. But these schemes, how these schemes work are everyone pays in, and then you make a claim, and then you get in line and you get paid, you get compensated eventually when your number comes up. The flaw in these schemes is that they do not have contracts with medical care providers, and when you walk in the door, you're essentially to the hospital. You look just like any other uninsured person, and they just they charge you an arm and a leg in their effort to cover their expenses. Now, in their defense, something like 50% of those personal invoices that are not submitted through insurance but are claimed directly from the patient never get paid. Okay, the people who show up and get the treatment and get the bill either can't afford to pay or just don't pay the bill, or don't pay their portion of the bill. In many cases, the insurance doesn't cover the entire amount, so the patient has to pick up the balance. And there's this insidious practice called balance billing, where the hospitals again try to gouge as much money as they can out of the patient, in addition to the monies they receive from insurance. So it's not that the hospitals are making a ton of money, it's that the hospitals are forced to compensate for the fact that the government screws them, basically, and the government messes with the healthcare system in such a way that it creates this perverse situation. An important way in which the government messes things up is that while you are not required as a medical care and a healthcare provider, you're not required to accept Medicare or Medicaid. You are required to treat people in case of emergency. So, for example, in my case, I ended up going to the emergency room some 3 weeks after the CT scan and underwent surgery a day later. They're required, even if I'd been penniless, they would have had to treat me, and chances are they wouldn't have gotten paid. In reality, they did get paid by me, and then I had to wait to get compensated by my scheme. I'll tell you another little secret. When I started going through chemotherapy, I was in the hospital for, I think, about 4 or 5 days in recovery after the surgery, a day before surgery, and then 4 or 5 days after. So, that nightly rate just racks up. I think it was like $1,000, $1,500 a night just for the hospital room. And then all of the services are on top of that. They charge you for every tissue, bathroom visit, everything they can charge you for, they charge you for. I then underwent chemotherapy, and we got an invoice after a couple of sessions. What that involves is you go down, you sit in a chair in a sort of a semi-private cubicle. They inject this stuff into your vein, or they put you on a drip, and it takes maybe an hour for that solution to be infused into your vein, and it hurts like hell. That stuff's like gasoline. It's not painless. It hurts like crazy, especially towards the end. It's very corrosive. But anyway, they might serve you a meal while you're waiting there, and then off you go. The drug itself is very cheap because it's off patent. But the hospital charged $20,000 per session. And as I said, it's 6 months of this treatment that you have to undergo. So the bill is horrendous. It's absolutely horrendous. And the profit on it is egregious for the same reason. They're trying to make all their money, compensate for all the other patients who either don't pay their bills or who the government forces them to treat and pays them a pittance. So in effect, it's a form of involuntary wealth transfer is what it is. So why do I go into all of this? My point is, and why do these hospitals accept these Medicaid and Medicare patients? Well, the unfortunate reality is that most of the patients, most of the revenue that flows into the healthcare system is from folks that are retired, older folks that are on Medicare typically. And without them, these people wouldn't have jobs. So they have to accept Medicare patients, and they try to, put them on an assembly line and get them in and out of there as quickly as possible. The Medicaid portion, I think, goes hand in hand with Medicare. If you accept Medicare, you've got to accept Medicaid. And that's for people who are not necessarily older, but who just are destitute, and the government will pay the bill, or at least a fraction of the bill for those patients. So that's why hospitals accept these schemes, hospitals and healthcare providers in general. Now, stepping back from my rather lengthy story here, what is the conclusion? The conclusion is the government has messed up the healthcare system by creating these strange distortions. The government is responsible for this mess. And to think that they're the ones that are going to straighten it out is naive. They're not going to straighten it out. They're going to make a bigger mess, as witnessed by Obamacare, which was an effort to get everybody covered by some sort of insurance contract, um, including those who have pre-existing conditions, which is a big deal. I mean, if you try to insure your house and it's already burned down, the insurance company is not going to accept your policy, and there's no moral or legal argument that they should. The same with healthcare. If you've already got diabetes or some expensive condition, there's no reason why the insurance company, no moral reason why the insurance company should cover you along with everybody else, or at least they should be entitled to charge you a lot more. But the government didn't like that. Politically, it was a hot potato, so they forced all the insurers to cover everybody, regardless of the conditions, regardless of the degree to which they were personally responsible for their condition. You know, I don't know what percentage, but a large percentage of medical conditions are self-inflicted, either through unhealthy lifestyle or some other smoking, alcohol abuse, overeating, lack of exercise. The list goes on, things that you can do to screw yourself up. So they imposed this law where insurers are forced to cover everything and they're forced to cover everybody. Naturally, that caused insurance rates to go up. I think Blue Cross Blue Shield now charges something. If you are just a person on the street not covered by, let's say you're a small business person like myself, and you're not old enough to qualify for Medicare, I think Blue Cross Blue Shield charges something like $25,000 a year. And what you're paying for is you're paying for all of these people that have these pre-existing expensive conditions. Even if you're in perfect health, you pay for the unhealthy. So that wasn't the solution. That really wasn't the solution. And I don't think government is ever going to be the solution. The various countries around the world have implemented the, single payer. You hear these people going on about single payer. What that means is the government now forces all these medical providers to treat everybody, and the government tells them how much they're going to get paid for that treatment. And they skimp on the payment, of course, because government never has enough money. And as a result, the care just goes down the tubes and people end up on long waiting lists because nobody wants to be a doctor anymore and no investors want to invest in a hospital. And in many cases, parallel private systems spring up to deal with that problem, and people who can afford it avoid the government scheme altogether. This is the case in England, for example. In Canada, which another country I'm familiar with, I happen to be a Canadian citizen. I have relatives in Canada. It's very, very difficult to get a GP. You virtually have to win the lottery to get a GP because there's a shortage of GPs, especially outside of the major urban areas. No GP wants to live in, Regina, Saskatchewan, or some other bizarre or the remote place where it's winter most of the year. So that's what happens when governments get involved. They make a royal mess of things. Could the private sector do a better job if healthcare were totally privatized? It could for the majority of the people, but you're still going to have the problem of people of little or no means that require expensive medical treatment. And that's a societal question as to whether you're willing to carry the burden of keeping those people or taking care of those people. I'll tell you one thing that's for sure, though. Something's got to give, and what's going to give is old people are going to be allowed to die rather than being treated. The harsh reality is that in the average your average lifespan, most of your medical expenses are incurred in the last month of life. Okay, you contract some terminal condition, or you have some terrible injury, you're not going to make it, but they treat you all the same. And they spend a lot of money keeping people alive for that last few weeks. In some cases, they're successful, which is why people, demand that attention and care. But in most cases, they're not. So the person, they spend $500,000 on a patient, and the patient dies anyway, and everybody knows the patient was going to die. That's the path of least resistance right there. So get ready for it. You're going to have to accept that when the end comes, they're just going to keep you comfortable and make sure you've drawn up your will, and good luck, buddy. You're off to heaven or hell or nowhere, depending on your belief system. All right, well, that's a rather gloomy topic, but that is a politically incorrect topic, but that's what I do. And I hope you found it educational. And that's it for today. You have a healthy day.